Coming up,
we want to get their quality of life back to what they want it to be.
we're all looking for ways to stay young and out of pain. This orthopedist uses the latest technology to do just that. Speaking of young, Fort Lauderdale United is SoFlo's newest professional sports team. We'll meet one of the players and find out what she does to stay healthy. Plus, this private school has created a pre-med program that can begin as early as junior high. All that and more is today on SoFlo Health. They say that travel is one of the only things that you can buy that makes you richer, but it can also make you healthier. Welcome to SoFlo Health. I'm Hunter Frankie, and whether it's reducing stress, improving heart health, or boosting brain power, travel is excellent for your well-being. Take Costa Rica, for example. With its Pura Vida lifestyle, lush rainforests, and relaxing beaches, it's one of the best locations to unplug and de-stress. But get your passports ready, because that's not all. We've got 3 more destinations and their health benefits coming up, but first, watch this. The Women's USL spring season is in session, and on the 26th, Fort Lauderdale United, who's right behind me, will be playing their first match of the season. So let's see if we can get someone off of Beyond Bancard Field here at Nova Southeastern University to answer some questions that you might want to know. How do you stay healthy? What do you do to prepare for a game? And more. We were lucky enough to be able to get Addie right after practice. So Addie, thanks for sitting with us. We appreciate it.
Of course. Thanks for having me.
I've got some questions for you that the people at home may be wondering when they come to see you play. Do you want to answer them?
For sure.
All right.
Yeah.
So the first one is pre-game meal. What's your favorite thing to do?
Well, actually, I'll have like a morning brunch, a good coffee, and then later in the day, I'll usually get a sandwich.
Okay.
Pretty
great.
simple, like ham and cheese. That's
Nice.
it.
Something simple so you're not too full when you go out to play.
Yeah.
All right. How about the game's done? It's time to eat. Do you eat, or do you gorge? Do you eat something light? What do you do?
If I am wanting to eat, I usually go for something super unhealthy. This is really bad. Don't take notes, but sometimes I'll like go get McDonald's, honestly.
Oh, nice.
Yeah, right after. But other than that, I don't really have a go-to.
Yeah, but it sounds to me that you're probably burning enough calories that it's not making too much of a difference.
Most days, yeah.
Okay, most days, great. How about recovery? People discuss recovery all the time. What's the best way to do so? How do you like to recover, either from a workout or from a match?
I feel like I'm a little different sometimes. I will just like sit on the couch, lay in bed. I love to watch TV. Sometimes I'll use recovery boots. And then we were fortunate enough that they just got us a deal to go to Restore, actually Wellness. So a lot of us have been using that. I'll go there sometimes, but
okay.
yeah.
Nerves. Do you get nervous before a match?
Sitting around and waiting all day does make me a little nervous, but once the game starts, it goes out the window, so.
Do you have any tricks for bringing those nerves down? Do you channel them into energy?
We always play music in the locker room. That helps. I think just keeping my mind off it. That's why the mornings I'll go do brunch. I'll kind of walk around, take my dog for a walk, just to not sit and think about like what's coming later. But
great.
Yeah.
Last question for you. The season is continuing now.
Yeah.
What are you looking forward to most?
I think we're in a really good spot. We finished off so strong, and so just to get back out there and kind of pick up where we left off, I think I'm most excited about that.
Great. We're excited to see you out there. Thanks for spending some time with us. We appreciate it.
Thanks for coming. Of course. Nice to meet you.
Fort Lauderdale United matches offer affordable family fun with pre-match and in-game entertainment, discount concessions, and an elevated VIP experience. If you want to join the fun, you can find tickets at ftlutd.com. At some point in everyone's life, they'll experience pain. Hopefully it isn't chronic, but if it does become chronic, there are actually solutions out there that are non-surgical. That's why we came to Rothenberg Orthopedic and Spine Care today to find out more. Let's meet the doc. Doctor, thanks for being with us today.
Thank you for having me.
Of course. So what is it you're doing here on a regular basis?
What we do here is we take care of people with all sorts of orthopedic problems, shoulder, hip, and knee, as well as spine issues. And we treat them non-surgically to help them avoid surgery.
All right. You've got a lot of cool tech everywhere we walk, but what's this behind us and how is it helping you do your job?
So this is a fluoroscopy machine, and basically this allows me to drive a needle to an area of pathology, and we use a little contrast flow, and you can see the contrast wrapping nicely around the hip joint to ensure that our deliverable product gets to the exact place that it needs to.
And what are you hoping to achieve for your patients with these injections?
We want to get their quality of life back to what they want it to be.
I had really no movement of my shoulder. I mean, I couldn't lift it past here. I had the cellular treatment, and I have to say it was like a miracle. Within 2.5 months of my shoulder, I had complete movement. I was lifting weights. I was playing golf. I mean, it worked out so well. And the thing with the procedures here is that you can have them accomplished, and then if it doesn't work as well as you think it should, you can always have the surgery.
It sounds like she feels so much better and is excited to have been able to do so without surgery.
Absolutely. Melissa's just one of many that come through our office, and quite frankly, we are treating people in a non-surgical way, but we're really doing it in advanced regenerative techniques in order to help these people ultimately recover their function.
Doctor, if people would like to find out more about what you're doing here, how can they?
They can visit our website, give us a call on the phone. We're going to make sure that you get seen the same day or next day.
Well, doctor, thank you so much for your time. Appreciate it.
Thank you.
You got it. Come right back for the incredible story of doctors going the distance to bring this man back to life after his heart attack when SoFlo Health returns.
Focusing on you. Innovations in modern medicine from your team of experts at UHealth, the University of Miami Health System.
Alan Shima loves singing in church, but a recent trip to the ER put the music on pause.
They said, "We notice you have a blockage here at 90%.
Alan had carotid stenosis. Dr. Arash Bornak, a vascular surgeon who specializes in carotid disease at UHealth, says a blockage in the carotid artery can lead to stroke.
When these fatty deposits over many years progress, they form plaque, and that results in narrowing of your carotids. At some point, if the narrowing becomes severe enough, that can cause basically a stroke or stroke-like symptoms.
UHealth is uniquely positioned to treat patients with all types of carotid artery disease. Because of the location of Alan's blockage, Dr. Bornak performed a highly specialized procedure called TCAR.
Transcarotid artery respiration, or TCAR, and that's done through a small incision over the base of the neck. Basically reverse the blood flow up from the base of the neck up to your brain, and we jail the plaque that could potentially have caused a stroke in the future.
I'm in good hands, and I know this is going to be great."
After TCAR, Alan's risk of stroke dropped to less than 1%. He says thanks to Dr. Bornak, he hasn't missed a beat.
That made all the difference in the world for me.
Welcome back to SoFlo Health. I'm Hunter Frankie, and before the break, we were talking about your health and de-stressing with a little bit of travel. And Costa Rica is an excellent location for de-stressing and unplugging, but maybe you like to travel and get your health going by moving a little bit. If that's the case, look no farther than Switzerland, because Switzerland is a great place to go hiking in the Swiss Alps, but it'll not only get your blood pumping, the fresh, clean mountain air combined with the slower pace of lifestyle while you're there is also good for your blood pressure and will help you relax in its own way. And that's not the only place that you need to go to travel for your health. There's plenty of locations, and we've got a few more coming up after you watch this. Tom Costello was clinically deceased for over half an hour, but lucky for him, he was right here at Mount Sinai Medical Center, where he made a miraculous recovery. And we're about to hear his story from him and his wife. Then we'll meet the doctors that made that miracle possible in just a minute.
I woke up early, approximately 5 o'clock, and I had some chest pains. And I mentioned to my wife, I woke her up and said that I need to go to the hospital.
It was a good hour and a half before Dr. Fuentes and this other young doctor came in to tell me, listen, he was gone. And we worked on him for 40 minutes. But he's back. He's in a precarious situation. It's very serious. But we got him back. I'm
very grateful for the entire staff, from the EMTs to the nurses to the doctors. They were wonderful. And they never gave up hope on me.
I don't know if he's going to remember half of it, but there wasn't 1 minute that there wasn't a nurse there checking everything. Anything I asked for, my son asked for him, they got it immediately.
I'm doing fine. I'm going to outpatient physical therapy 3 times a week, and I'm doing fine. I'm walking fine. I feel great.
I'm now joined by Dr. DeBeer and Dr. Fuentes. Gentlemen, thank you so much for spending some time with us today. We just spoke with Tom. He's also very thankful that you spent some time with him. Tell me a little bit about Tom's story from your perspective.
One of our ER doctors very appropriately called and said, hey, we have this patient. He came in with a heart attack. Unfortunately, he had a cardiac arrest. We've been performing CPR on him for around 30 minutes now, and unfortunately, we've not been able to regain any vital signs. At that point, we activated our ECMO team, and we mobilized all the equipment down to the emergency room. And so we, immediately went about getting access into arteries and the veins. We were then able to shock him out of that fatal arrhythmia back to a normal perfusing rhythm, but we were still very concerned, obviously, with the active heart attack that led to his arrest, and that's when I contacted Dr. Fuentes, and he took him to the cath lab.
So when I took him to the cath lab, we found that there was a big, massive blockage in the most important artery of his heart, which is the LED. So we restored flow, and then his other arteries also had blockages. So we placed additional stents, and at the end of that, we also placed this circulatory support machine called an Impella. And over the course of the next few days, 2 weeks, we were able to take them off, and Mr. Costello gratefully made a full recovery.
Greatly so. He's happy to be here today. He had a great chat with us, but he's incredibly lucky to be able to be, as he said, within 5 minutes of this hospital. And why was he lucky to be here in particular?
Well, eCPR is a very new technology procedure that is being implemented, more and more across the country. But again, we're one of the few hospitals that regularly offers this service, both in a hospital and out of hospital cardiac arrests. And he was lucky to be in a place where that was able to be provided in a timely fashion, and he had an excellent outcome.
Is there anything that you think that the audience should take away from this?
Mount Sinai has been at the forefront in South Florida for cardiovascular care. We have a tremendous team here, as with surgeons, with cardiologists, with interventional cardiologists like myself. And we have a lot of tools that are fortunately here at our disposal that we offer patients, and they have been shown to save lives.
Well, thank you both for what you do. I know that the Costellos are extremely thankful, and so are we, and thanks for spending some time here with us today.
Thank you.
Thank you.
You got it.
Thank you.
The future of healthcare education is here, and it begins in junior high for these students. Find out more after the break on SoFlo Health. We've already relaxed in Costa Rica, gotten our heart rates up in Switzerland. Welcome back to SoFlo Health. I'm Hunter Frankie, and believe it or not, this is actually a green screen. I know we probably had you fooled up until this point, but I just wanted to be clear. However, if you're looking for another travel destination that's healthy, look no further than Japan, where they have one of the longest life expectancies. It's a famous blue zone, and that's due to their healthy, fresh seafood available year-round, their lifestyles that are active, and the mindfulness practices that they have in their everyday lives as well. Now, there's still other places that you can travel if you're not looking to go to Costa Rica or Switzerland or Japan, but to find out what it is, you have to keep watching SoFlo Health. This is Dr. Sam Rasool. We're at Shin Wellness, and I'm about to say something that it seems everyone says. Dr. Sam, my hamstrings are tight. Why?
That could be for a number of reasons, Hunter, but a lot of times is what I see in my office, something called lower cross syndrome. You see this a lot with people that are in a sedentary lifestyle. They're sitting for long periods of time, they get shortened hip flexors, they get tightened hamstrings, and they always seem to focus on the hamstrings. But I always tell patients, you want to stretch certain areas and you want to activate certain areas. So let's show you a great hip flexor or a groin stretch you can do. I'm going to have you climb up on the table.
Sure.
So you actually put your leg up here, pretend this is the floor.
Okay.
So we're stretching the left hip flexor. So what you're gonna do is you're gonna actually shift forward and then turn toward the side like that. You can put your hand on your hip if you like, just like this. Now, the line of drive for your hip is 45 degrees into the floor or the ground in this standpoint. Then when you're done, you wanna rotate back this way and then use this leg to push right back up just like that.
Got it.
You can do both sides. That's a great hip flexor stretch, the forgotten stretch. Now, going back to what you said before, tight hamstrings, what can I do about it? Absolutely, you want to stretch them out, but there's a good way and a bad way to stretch out your hamstrings. Most people just bend straight down. That can put your lower back in vulnerability or compromise.
Yes.
A better stretch to do, Hunter, you can actually turn like this. We're gonna show it. You're gonna take your left leg and put the heel into the ground just like that. And you put your hands on your hips, and what I want you to do is slightly push your butt back. You notice how Hunter kept this curve in his lower back. He kept it straight just like so. He's pushing, he's feeling the stretch in the hamstring and also the calf. You notice how you didn't have to go very far.
Yeah.
So you're not putting your lower back into any kind of compromise or vulnerability. When you're done, slowly back up. We always talk about coming out of the stretches slowly.
Yes. Yeah, I felt that one specifically almost in like the top of my calf a lot, and then it kind of dissipated as it went up. So for me, I'm probably tighter, closer to where the hamstring meets the calf in that particular.
You're becoming your own Sherlock Holmes. You're discovering your body, which is a great thing. You notice where the tightness is, and you can focus on that.
Yes, and that's something that you can do pretty much anywhere. If you have a floor, you don't necessarily need to get up on a table and show everyone what you're doing, but in our case, we did so that you can see it. But if you have a floor, you can do both of these stretches and feel great while you're sitting.
Absolutely.
Or I guess you can get up and then feel great when you sit back.
There you go.
Thanks.
No problem.
When you hear pre-med, you're probably thinking about college. But what if I told you that here at American Heritage School's Broward campus, that process can begin as early as 7th grade for some students? Let's take a look at the program and find out what they're doing differently to prepare the future of the medical field.
We're in one of our 3 scientific research labs, and these are college-level labs, so we have close to $1 million worth of equipment in our labs, and they're BSL-2 labs, which means we literally can work with bacteria and viruses, which you just don't see at the high school level. You see it at the collegiate level. We start preparing students in junior high. So we start working on their SAT and ACT in junior high. Those skills are infused into the curriculum, so by the time they get into 11th and 12th grade, they're at a higher level than most students in the United States. We're the #1 private or public school in the entire state of Florida in National Merit Scholars, and consistently the #1 private school in the entire nation in National Merit and Presidential Scholars. We are one of the biggest philanthropic institutions in South Florida. So I believe we were ranked by the South Florida Business Journal as the 16th most charitable company in South Florida. So we don't ask for donations, we actually give donations.
So the concept was to give the students the opportunity to be prepared to be ahead of the rest of the regular student population into getting and deciding if they really want to pursue a career in medicine.
It's a rigorous program. I would tell the student, you have to be prepared to study, to put in extra time, to understand the material.
And utilizing their knowledge and the core concepts that we're teaching in the class to help them to solve problems, like access to medications, adverse events in medications, and how we can prevent those things, looking at a global health picture, essentially.
Then, for our students, it's not just the academic part, but they need to learn more about that compassion, about that hand that gives back to the community.
And understand the problems that patients face when they come in, the difficulties of being sick, and they develop a large degree of compassion.
So it's not just one well-circumscribed time point, you're getting them longitudinally.
And what better to teach these students to grow knowing that there's the need to give out more to the community.
And that's one of the most rewarding things about this whole program, is to see these students grow and become valuable, contributing members of society.
So feel excited, feel inspired, because the educational experience you get here is not comparable to anywhere else.
State-of-the-art equipment and innovative teaching styles aside, it's important to students and faculty here that there's also a level of compassion and humility brought to the medical field. And here's an example of just that.
I decided to involve myself in pre-med in 7th grade when I was starting junior high at American Heritage. I just found it very exciting that the program offered the opportunity to interact with patients to make a tangible impact on the community. And so I just decided to jump right in, and from then on I've just loved it since, and so I decided to stick with it. The support that American Heritage gives it's unheard of. The fact that we're able to go to these hospitals, to interact with these patients, to truly make a difference, and they know our names, we know theirs. We're making a real life connection with these patients, bettering their lives and just like creating some joy. And it's just the fact that we have the resources and the support from the advisors and the school to do so. It's just amazing. I want to be a doctor when I grow up, and I feel like the Pre-Med Society not just gave me the knowledge on how to do so, but it gave me the empathy and I guess the wisdom on how to connect with patients on that level. So from here, I want to continue helping others. I want to continue expanding, and I want to take the lessons that Pre-Med has given me and kind of bring it to wherever I go to college or wherever I end up in the future. I want to continue hosting such events, not just for patients, but for people of all backgrounds, for the homeless, for veterans, for different types of communities, hosting these events of sorts to bring joy and just truly show that we care.
It was very exciting to meet the doctors and students here at American Heritage that are the future of our medical and health fields. And I love to hear that they're not only concerned about being excellent in their field, but they want to bring kindness and humanity along with it. Welcome back to SoFlo Health. I'm Hunter Frankie, and so far we've talked about the stress-free beaches of Costa Rica, or the heart-healthy hikes that you can take in Switzerland. And if you're looking for some brain-boosting mindfulness, you can also go to Japan. But what if I don't want to go to any of those places, and I'm looking for something outdoorsy and cool and where they shot Lord of the Rings? Then you should look no farther than New Zealand. It's the ultimate destination with plenty of outdoor activities like kayaking, hiking, bungee jumping. It's a fitness lover's dream, but the bottom line is you can go pretty much anywhere and find something healthy to do, and traveling is a great way to explore and take a break from everyday life. Lucky for us, we live right here in SoFlo, where we get to experience a little bit of all the places we mentioned today right here. And if you've been watching SoFlo Health, you'll know exactly where to go. That's all for this week's episode of SoFlo Health. Thanks so much for watching. As always, if you'd like to catch up on previous episodes of SoFlo Health, you can do so on SoFloShows.com. You can also follow us and share with us what you're doing to stay healthy using @SoFlo Health. Until next episode, it's goodbye and good health.